I once had a situation where I wasn't able to raise my arm. This is before I knew I had fibromyalgia.
Yes.
And they sent me to a lot of doctors, and I ended up in Southern California. And I'm really right-handed. I mean, it had gotten to the point where I had to try to brush my teeth, holding my hand still and moving my teeth over. It was so uncomfortable. I could not raise my arm. And they thought I had a rotator cuff problem.
Yes.
They sent me to, I had a doctor that had done some neck surgeries on me, Dr. Delamarter at UCLA. So I'm hoping that maybe we can get some contacts in here. Dr. Delamarter referred me to a doctor at St. John's to do a surgery.
Yes.
Where they went in thinking that it was rotator cuff. 1993, they, instead of finding that, I ended up in a hospital bed because it was supposed to be an in and out surgery. But I ended up in a hospital bed because they had to make a big incision. They removed a large, what they called a large mass on the front tendon here. A large mass. And when I asked what it was, and this was before I knew anything about, what we were dealing with here, I don't think they had done a biopsy per se, but it was, we went through, was it a cyst, was it a malignant growth, was it, and no, nothing like that. And I said, well, I get a lot of calcium deposits. Was it some kind of mineral deposit? They said, yes, it was a mineral deposit. They could not see it in any of their, they saw everything else I had had. My first rib removed. I had a cervical rib worked on. They saw all sorts of leftovers from all of that,
Yes.
but they could not see this mineral deposit. And they said it was a large mass, so this was something that probably, it should have been, observable, but
it should have, but they didn't know what to test for, right?
Right,
And then,
right.
and they didn't do any comprehensive tests because, they didn't know what to
they
do.
had no idea why it was there.
And so that's why when my patients come to see me, especially new patients, and they've been referred to a surgeon because of pain and immobility, I say, continue to touch base with the surgeon, get physical therapy, start guaifenesin, and let's give it a year. And especially these are patients that haven't had an injury to that area, right? Where there's not that we don't think there's a structural problem, it's often fibromyalgia.
I was in sports, that was all.
Yeah.
I had never really heard it in any way.
How is your shoulder now?
It's wonderful.
Yeah. And so I'm going to just touch real briefly on back surgery because one of my friends just wrote a book called Crooked. It's about the back surgery industry, and found that surgery for lower back pain is hardly ever effective. And the most effective things are exercise and physical therapy. And obviously if you have fibromyalgia, treating the fibromyalgia. Now, it's different for higher neck pain. Sometimes that can be more effective, but still, it's surgery. It causes, they cut through things and then there's scar tissue, and it's just, that should be a last resort. Unless you're having nerve compression. If you're having nerve pain and if you're having numbness and tingling, then there's pressure against your central nervous system, your spinal cord, and surgery is probably more necessary for you.